Good morning and welcome to Nashville. And on behalf of our entire executive team, board, and 1,500 plus employees and 60 odd customers from across this country, I'm thankful for you making the visit here. Our attendee base includes 90 plus organizations from across 5 different countries, representing various parties and participants in the ecosystem we call healthcare.
When I think about healthcare, the first aspect is how do you engage people around their health? How do you help them, whether they're sick and to help them get healthier, or if they're wanting to maintain their health? And engagement with the consumer is such an important part of that.
We live and die by our engagement, both with the consumers, the patients, but also with the providers or prescribers, and in many cases, the pharmacies. So we have to sit in the middle and engage all constituents.
The fact that I am now educating myself as a consumer of my own health plan differently than just worrying about a copay or a deductible, I've already started the consumer-driven side of that. And so I believe the notion of, can it be a win-win, is a yes.
I want the best as a consumer of the patient care. And so it's that having that ability to go and get that access anywhere. I think the telehealth is really going to change the dynamics of the consumer and the expectations.
The sheer fact of the supercomputer in everybody's pocket, the mobile device, has really catapulted the way we are able to connect with information literally 1,000 times per day. That's the average amount of time people check their phone. It's crazy.
The biggest thing that we can provide as a healthcare industry is transparency.
I think this has a lot of promise to be something that's going to be very impactful to this nation.
I've been truly impressed by the caliber of attendees that you've created, the caliber of conversation, whether it's the break time conversations or the panel speakers, but really creating various points of connectivity across a provider group that typically is not coming together with the payer community and the technology community. This very intimate environment that you guys have created actually facilitates lots of dialogue that's meaningful and driving business.
So I think the summit was really well done. I like the fact that it's sheer panels versus the presentation style, and it gives a chance to hear a multitude of different perspectives. So I appreciated the breadth and the scope of the people here today.
The ability to be here with peers and colleagues who are innovating and pushing us forward as an industry is really powerful.
It's a real cross-section and spectrum of the healthcare enterprise, and that's one of the things that I think is really unique and is special in the Emids Healthcare Conference.